Hello, my name's Karen and I wanted to talk you through a massage just for a few minutes on somebody who is suffering with cancer and what you would do and what you would think about prior to treating that person and how you would actually do the massage itself. So before taking somebody who has cancer on your books, it's very important to think about what kind of cancer they have, where the tumour is, the treatments that they're undergoing at the moment, whether it's radiotherapy or chemotherapy, and the sites of the treatments, to think about whether they've had any operations before and if they have had recent operations or injuries to those sites, and also previous medical history that may not be associated with the cancer at all, but to think about accidents and injuries, skin conditions and so on. So the treatment that you're going to give takes into account all of those things, and a patient shouldn't be seen for treatment with cancer unless they've had a referral from a consultant or a doctor. And so once you've had all those pieces of information and you're happy to treat the patient and you've explained what you're going to do for that patient, then the treatment can begin. So I'm going to start by just placing my hands on top of the patient and thinking about making that connection and considering the oils that you're going to use. Sometimes patients can suffer with nausea and feelings of sickness and vomiting as a result of treatment, or there might be other physical conditions to take into consideration, such as chronic pain or a skin condition as a result of the therapy that they're undergoing. But as well as the physical problems that can arise as a result of cancer treatment, sometimes deep emotional issues need to be considered, issues of trauma and grief, emotional distress. And aromatherapy oils can also help on a very deep level as well as treating the physical conditions. So today I'm going to be using rose oil. I'm just going to take the towel back just to protect the clothing. And rose oil is very good for helping with trauma and grief. And you start at the base of the spine and just work up very gently. And the first move one always does when doing massage is effleurage, which helps to spread the oil around, creates a connection with you and the patient, lets the body know that it's going to have some work done on it, starts to warm up the muscles. And you can judge the skin, the condition of the health of the individual, just by being aware of what happens to the oil, whether it's easily absorbed. And you can also see if there's any swelling or redness or any other difficulties, fairly obvious with the skin. So I'm just going to get a little bit more oil. So we're starting off with an effleurage movement, and then we can, if it's appropriate, move into a deeper massage. It's called petrissage, and involves just picking up the skin, just passing it from side to side in a kneading motion. And as well as picking up the skin, we start to move into the soft tissues, into the muscles, taking care to just go up and down either side of the spine, not working on the spine itself. Going up the other side. And if you find any areas of tension, stress, where we hold on to a lot of anxiety in the shoulders, just doing a little bit of extra work in there to help them relax, feel supported, at ease. areas such as the lower back that can hold pain, anxiety. Just doing a couple of effleurage movements in between. And then if it's appropriate, the next level of massage is to go into friction. Now for some people this just wouldn't be appropriate, but for others, friction is where you get in deeper and are more specific with the moves. So it might be that you find some tension underneath the shoulders, and just work into that with your thumbs. And the top of the shoulders, we can use the knuckles, just softly, finding those tight spots. And the same the other side. Underneath the shoulder, and then up to the top with the knuckles. So massage would usually last about half an hour to neck, back and shoulders, depending on the condition of the patient, what they need, how they're feeling. Working up into the neck and finishing off with some deeper effleurage movements. Right into the nape of the neck. And allowing the patient to remain in that relaxed state for a few minutes before they get up and get on with their day. Thank you.